Welcome to eYe Education. I'm your host, Ed Leicius, and today we're going to be talking about a matter that is on everyone's minds, and that is the COVID virus 19. And we have the experts to help us with that, both from the public health and the education standpoint, with us here today. Joining us here in the beginning, we have the Director of Public Health in the City of Nashua, Bobby Bagley, and the city's epidemiologist, Angela Constantino. Welcome to the program, ladies.
Thank you.
Thank you, Ed. It's good to be here. It's a very important conversation that we need to have.
So how did we get here, Bobby?
So we are here today talking about this very important public health incident because of coronavirus, COVID-19, that is spreading across the country and affecting us here in New Hampshire as well. I brought Angela Constantino, our epidemiologist, along with us today to have a conversation about how the virus started, where things started, and we'll have some conversation based on some of that information so that we could figure out what we need to be doing here in Nashua.
Angela, when was this virus first discovered and where?
So this virus, this novel coronavirus, was first discovered in Wuhan City, China, in December of 2019. That's when we started to notice it on a global scale. And then the virus moved out of China and into the rest of the world in January. And we saw our first case in New Hampshire in March.
And as a result, what, in your role as epidemiologist, what have you been doing along with your fellow employees at the Public Health Department here in Nashua to prepare the citizens and assist them with dealing with this?
So right now and at the beginning of this outbreak, our main focus was on containment, so containing any possible cases or contacts of cases that we saw. So we stay continuously updated with the CDC and the New Hampshire Department of Health and Human Services, and they push out information such as like travel advisories and preventing the spread of infection. So we were working to push out those messages to our community and also keep an eye on containment in regards of contacts of cases and things like that. So when we move forward and we have more cases, or if we do see more cases, then we'll be focused more on mitigation and less on containment.
In a normal world or day, what would you be doing at the Public Health Department other than focusing in on this?
Yeah, so what I typically do is a lot of data analysis, data collection. My training is in biostatistics and epidemiology, so I really like the data analysis piece. So at the health department, we have community health assessments and community health improvement plans, and those assess the health of the community statistically. So we work on those.
And Bobby, how has this impacted your overall operation at Public Health? You know, you're busy enough on a regular day, on a regular week. What added burdens, for lack of a better word, has this imposed on you?
Thank you, Ed, for that question. What this has imposed on us is a focus on making sure that we get information out to the public that is updated information informed by the CDC, by our State Department of Health and Human Services. And so it requires a continual monitoring of what's happening, not just globally, but statewide as well. And so it's good that we have Angela on board who, with the data analysis, we try to take a data-driven approach. And in our role of Chief Public Health Strategist for the city, our goal is to make sure that we follow what's happening, follow the trends, get information out as timely as we can based on what we get from the CDC and what we get from the state, and then keep the community and the public as informed as we can. Our main goal is to make sure that we prevent, protect, and preserve the health of the community, especially our most vulnerable populations. So that requires for us to have eyes on and pay attention to what's coming through the communications the communication chain, I'm sorry, and then make sure that we get that information out to our community partners, to our community leaders, connecting with the mayor, working with our Office of Emergency Management, our partners at the hospital, community-based organization, and everyone that can help play a role in getting the information out to the public.
And at what point did you start gearing up or ramping up to address this situation?
So basically, we started out with weekly calls with the state, focused mostly on hepatitis A until things switched over to attention on COVID-19. And we opened up our MACE the last week in February so that we could have continuing monitoring of the situation.
For our viewers, what is the MACE?
So the MACE is our multi-agency coordinating unit. And what that, coordinating entity. And what that means is that internally, again, we're monitoring what's happening in the state as well as what's happening across the country with COVID-19, looking at when and if the number of cases arise to a point where we have to do more than just looking at containment and move to mitigation in Nashua.
Why is it that, you know, there's over 8,000 people who have died from the flu, and that doesn't seem to get the notoriety, but something like this does? Is it because there's currently no antivirus vaccine for it? So
there's a combination of reasons, and Angela and I will both talk about that. This with COVID-19, what you're seeing is people in a particular population group that are the most vulnerable, those who have underlying medical conditions that are being impacted greatly by this. And the infection rate of this is higher than what it is with the flu in itself. We don't want people not to pay attention to the flu because flu is still active, and it's still a very serious illness for a number of folks in our community. COVID-19 seems to be affecting people at a greater rate faster. Would you say, Angela? Yeah, so we use a reproductive number to determine the infectivity of a disease. So COVID-19 has a reproduction number of between 2.3 and 3, we're not really sure yet. Flu has 1.5. So that means that each person that gets the flu infects 1.5 people. Each person that gets COVID-19 infects 2.5 to 3 people. So people are getting sicker faster with this novel coronavirus. And also, too, the fatality rate is different. So the flu fatality rate is about 0.1%. So 0.1% of people who get flu will die. And coronavirus, we're looking at about 1.5 to 2% mortality rate, but we're not sure, again, because a lot of times, well, right now the situation is not all cases are being reported in the numbers because the sickest people are the ones who are going to the hospital, and those are the ones that are getting counted. So people might be sick and we just don't know because they're not accessing care. So if I've had a flu shot, should I worry about this? You still need to worry about this if you've had a flu shot. The flu shot will protect you against influenza and the different strains that are covered in the vaccine. Right now, there is no vaccine for COVID-19. What it will do is lessen the severity of illness with the flu and prevent flu. But right now, for COVID-19, we need for people to be vigilant with hand washing, with staying home if they're sick, if they come into contact with a person who has been identified as being at risk as a case or exposure to COVID-19, we need those individuals to make sure that they stay out of the public. Social isolation is what's going to help us maintain and keep the numbers of COVID-19 down. With flu and influenza, I mean, the symptoms present the same way, with fever, with cough. And so if a person presents with influenza-like illness, we want those guys to make sure that they stay at home. Monitor their illness, make sure that they connect with their primary care providers and let them know what's going on. If symptoms worsen, they also need to make sure that they connect with a primary care provider and make them aware of what's going on with that as well. COVID-19 is serious in the population of folks that are the most vulnerable and the most at risk. And again, we want to make sure that we can maintain the safety and well-being of those individuals. So it's the middle of March. If I haven't had a flu shot yet, is it wise to get one now, or should I just wait till next year? No, if you haven't had a flu vaccine, Ed, which I hope you have. I have. People can still get and still should get the flu vaccine. Although we have a certain time period of when flu season runs, you can get the flu at any time during the year because people travel. And so if you haven't been vaccinated, we do encourage folks to go to their healthcare provider, go to CVS or Walgreens, come to the public health department and get the flu vaccine because we want to make sure that they're at least covered for that. Flu status is widespread in New Hampshire right now. And so if you haven't been vaccinated, you still should get vaccinated. So
Does the weather have anything to do with the spreading of this, Angela? I mean, we've had an unusual winter in New Hampshire, very little snow, cold yet warm weather, and then more cold weather. Does that have anything to do with it, or how does this spread?
So this is spread via respiratory droplets. So if I cough and sneeze, and Bobby touches something that I coughed or sneezed on and then touches her mouth, she will be exposed. Or if you're in close contact with someone talking, things like that, respiratory droplets spread. So we're not sure yet if this virus has seasonal variations. People have predicted that it does, but we really truly will not know if there is seasonal variation until the seasons change and we can determine if there is a decrease in cases because of the season change or correlated with the season change.
And a constant that we've heard throughout, and I imagine we'll hear until it's over, wash your hands.
Wash your hands.
Often. And there's a, what, 20-second rule?
20 seconds. Sing the happy birthday song.
Twice. Happy birthday twice.
Yeah, but that's really important. And one of the things that we've always emphasized in public health and in precaution and prevention is hand washing. Good hand washing. If you can't get to soap and water, then use hand sanitizer, but do something to reduce the amount of bacteria or virus that's on those hands. And then make sure that we don't touch our face, our eyes, or our mouths. Throughout the course of the day, we do a lot of touching of things, and so we really want people to be mindful that you can really stop the spread of influenza, COVID-19, norovirus, and a lot of other infectious diseases by washing the hands frequently and often.
You've been out there educating the public, and we're going to talk to your education communications person in just a little bit, but you've also done a lot internally with the city staff, city employees. What was the message to them for the workplace?
So for the workplace, the major message that we want to get out to folks within the city is, if you're sick, stay at home. That's the best way to prevent and, again, contain this. That if people are sick, stay at home. Maintain good personal hand hygiene in the workspace as well, because we can touch objects, which we call fomites, and we can leave bacteria and virus on those objects. And so, again, it goes back to the hand washing. And number one, again, if you're sick with fever, cough, any symptoms that are aligned with respiratory illness, stay at home.
The city, the schools, businesses, everyone's getting involved in this. And we've got some more experts who will come in and join us here on the eYe Education.
Thank you, Ed.
Thank you. As I mentioned previously, businesses, schools, and homes are all taking steps to address this situation. And we have with us now the Superintendent of Schools, Dr. Jamal Mosley.
Hello.
And the city's public health nurse, Flavia Martin.
Hello.
Dr. Mosley, what is the Nashua school system doing in response to this virus? And have you started to look into alternatives in the event of we have to go to school closings for any period of time?
Well, first of all, thank you for having me on your show. Part of what I think is important is to have a line of communication. So we've been working very closely with the Public Health Department here in the city to make sure that we're getting accurate and current information. Once we get that information, we have drafted correspondence to parents so that they're informed on terms of what we're doing to make sure that we are in sync, but also keeping our kids safe. So what we're doing in the schools is that we've increased our cleaning our practices to make sure that our schools are extra clean for our kids. We've also put out some information coming from the public health around good practices, washing your hands. I was just standing in the background there. I heard happy birthday to you twice. I would say maybe sing the Star Spangled Banner once to yourself and then follow up by a happy birthday. We've also made sure that our kids know that we've put some suspended all international travel at this point for our kids, areas that have been affected by the coronavirus. We've also not supported field trips to those areas as well as a form of being proactive. We've also monitored the situation to make sure anytime that we're experiencing changes or expectations around the coronavirus that we're responding as a district to make sure that we keep our kids safe. In terms of school cancellations and what that conversation feels and looks like, we're not there quite yet. Understand that a city of 11,000 plus students, when you talk about online learning, that means that we're making the assumption that every single student in the entire city of Nashua has internet connectivity along with a computer. And for some of our families, that's not the reality. So we have to be sensitive to that. When we get to that conversation, we'll certainly have to have a discussion with our educators, our families, and what that feels and looks like. I think finally, I hope that all of our families are tuning into this, watching it a couple times, having some discussion, being aware that there are places in the world that are currently experiencing this coronavirus very severely, and not to be, not to be cognizant of that would be problematic.
Have you noticed an uptick in communication, either email or phone calls into the office from parents with concerns and questions?
Absolutely. And what we've tried to do, and I say try because, we're talking right here, but as I would say that the number of cases being identified and confirmed continue to be of concern to our parents, and they want to know what we're doing. And so, yes, it's been an increase, and we've been responsive to that. I would say this much, and I'm putting it out there. You will please go to the district website to find out current information in terms of what the district is doing. We don't do Facebook, we don't do Snapchat or anything like that. We do directly from our website, and we do have a school Twitter account that we also make notifications as well to the city.
And you've been pretty good about using those means to communicate in addition to the actual written correspondence from time to time going home with the students to their parents. And really, rather than flood the switchboard, that's probably a good recommendation to keep monitoring that, and you will update it as needed, even if it's several times a day.
What we try to do, I say try, as soon as I get the information, I try to get it out there as quickly as, not me, but my team tries to get it out there as quickly as possible because we recognize the severity, but also the concern people have. I also want to make note, Mr. Lucius, is that we also put it in 3 other languages as well. So we do it in Spanish, and we do it in Portuguese for our families who speak different in various languages.
Flavia, public health nurse, usually don't hear a lot from you. You've been here 2.5 years. Now all of a sudden you're kind of thrust into the limelight because of this virus and working with your colleagues at public health. What can you say to alleviate some of the concerns and fears that parents who may be viewing this program might have?
It's in the media, it's kind of sensationalized a little bit. It is a serious disease, an illness. But the thing that is very important is that in New Hampshire, we don't have community-wide spread yet, okay? So while it should be in people's minds and people should be, thinking about it, we don't have community-wide transmission. So by going to the grocery store, on a normal day, you're probably not gonna get it. By going to the movie theater, we're not at that level yet.
How much bad information is out there? I mean, I saw something recently that said 27% of people surveyed aren't drinking Corona beer anymore because they feel that that's causing this virus. And I know that they're suffering as a result of it.
There's a lot of misinformation out there, especially with social media. Somebody starts something right here, all of a sudden, spreads like wildfire. You mentioned the Corona beer, and then you turn on the news, and then you see the people with face masks all over the place too, which we know when we've been putting the message out there that face masks are for people who are ill to protect other people that are healthy from getting sick. So as a healthy person, I put on a face mask. It's really not going to help me. In fact, it might even get me sick because I'm going to be touching my face and constantly adjusting. So you have actual increased risk factors. Yes,
I've heard that, and that's an interesting point because for a while, there's been a run on that, hand sanitizer and everything else associated with keeping yourself healthy, so to speak. What other do's and don'ts could you share with our listeners?
We can't stress the importance of hand washing enough. You know, for flu, norovirus, all types of bacteria and viruses out there, hand washing is huge. And another thing that we want to drive home is that people who are ill should really stay home sick. This isn't new because of the coronavirus. If somebody has a fever, they shouldn't be going to work, they shouldn't be going to school. If somebody has diarrhea, they shouldn't be going to work and school. So those are a couple of the points there. Cover the cough.
We don't have a lot of large public venues here in Nashua, but what would be some examples of places with a crowd that people might avoid, especially, as you say, if they're not feeling good?
Any place where they're going to be in close proximity to somebody else, they should avoid if they're ill. Places, like I said, the movie theater, where you're going to be sitting there for 2 hours with neighbors right next to you. If somebody's sick, they should stay home, should stay away from that. Any type of like mass gathering events, functions, you know, parties, all that kind of stuff.
The NBA, the NCAA, talking about playing their games the rest of the season, perhaps in gymnasiums and facilities with no audience. Has there been any discussion that you've heard or come across your desk, or that Lisa Gingras has communicated to you about anything the NHIA might be looking at, or the Nashua School District about just limiting it to the competitors?
Yeah. I think that we haven't had that discussion yet, but certainly as we start to understand, and again, as much as I'm the superintendent, in this case, I'm part of a larger team. And so I'm looking for that feedback coming from the public health. I'm looking at that feedback coming from my administrative team. Also, we have not had that formal discussion yet, but certainly if that comes across our table, we'll certainly entertain that in collaboration with our city officials. I think it's, to Flavia's point, just to kind of go back in terms of what the school is doing, I think the hardest part for us as people who work with kids, we're committed to our work, but yet we want to come to work. And you know, and trust me, I'm the biggest offender out there when it comes to being sick. I mean, you just say, if I miss one day, I have 2 days of work to make up. And I think our teachers, our administrators, our paraprofessionals, our custodians, we all just want to be here, particularly in this case because we're breaking into spring, the grass is growing, you know, it's 70 degrees out. And we feel like we want to be there. And you're asking us to stay home, and that's hard for some of us because we usually come in sick. Yeah, not sick, but we come in not feeling well. But I think, to Flavia's point, that we really have to take this seriously and stay home to take care of you, but also to take care of the community because you don't want to make other people sick. The other piece to this, I think it's important, is that, you know, there is a lot of media coverage on this, and you know, now you can even, we watch the media and sources, and we have to be careful about the source of information. I wasn't unaware about the Corona beer. You know, I'm not a beer drinker per se, you know. What a great deal on Corona. I don't know, you know, if you want to purchase that. But at any rate, you don't want that misperception out there either. And so, you know, the best experts are right here, and Bobby Bagley and her colleague was here earlier, and I think staying tuned and hearing it from them as well. So we haven't had those discussions with the appointment solutions. We haven't had that discussion around the sporting events. We're moving in to the spring season, so we have a lot of our extracurricular activities outside, which is a nice kind of venue, and my understanding, and please correct me if I'm wrong, that the warmer the weather, the less likely it is to spread.
I think we're all kind of sitting back and, you know, hoping to see that pattern as it is with flu and other type of viral illness, that as soon as people are outside and you got your windows open, there's less transmissibility there. But, you know, with the school sporting events and everything, we don't have that community wide transmission. It's really right now in New Hampshire, it's only associated with travel and close contacts. So until we start seeing that, at this point, there's no need to be canceling these things. But that will be a conversation with many people together.
We've been talking with Superintendent of Schools, Dr. Jamal Mosley, and our city public health nurse, Flavia Martin, about the virus that is capturing our attention. You're watching eYe on Education. We'll be right back. Welcome back to eYe on Education. We are talking about COVID-19, the coronavirus, and we're very fortunate to have had with us today the Superintendent of Schools, Dr. Jamal Mosley, and officials from the Nashua Public Health Department. Bobby Bagley's great team that has been working very hard and continues to work hard on this. And the Deputy Director of Health is with us now, Ren Bowden, and the Health Promotions and Communications Specialist, Nicole Vio. Thank you both for taking time to be with us. And it's probably a little more work right now than your normal promotion and information campaigns that you do during the course of the year, Nicole.
Oh, yeah.
What steps have you taken to get the word out to folks about what they should and should not be doing?
Yes, thank you for having us here today. So I do a lot of public information or public health campaigns. So social media, I update the website. So I've been working really hard to get information out to not only our community partners, but also community members. So it's important to know we don't only serve the city of Nashua, but also the 12 surrounding towns. So we have a whole contact list of all our regional partners that we work with throughout the year on a daily basis. So we've been reaching out to them. I've worked really hard on a fact sheet that we created for the community, so we've been getting that out as well. Along with updates from the New Hampshire Department of Health and Human Services and the CDC.
Now, normally when there's a disaster declaration, one of the areas that FEMA and the state use is rumor control. And we were talking earlier with your colleagues. There has been a lot of misinformation out there. What are you doing to combat that or address that when it reaches you?
Yeah, so I've also seen it in the news as well. I've heard my family talk about it. We've just been using reliable sources. So the CDC is our go-to for information, as well as the New Hampshire Department of Health and Human Services. We know that is the correct information, and we are staying with those sources.
Ren, how is this disease spread?
I think as it was stated earlier, through the droplets which are out there. So with that respiratory ways, that's how we're seeing this spread. But we also got to worry about the fomite surfaces, right? So meaning that any surface that is touched is something that could transmit. So we have to talk about cleaning, right? So what we understand of this virus is that it's pretty weak outside of the human body. So if it's on a surface, it can be fairly easily killed. So just your standard cleaning products, which are out there, the EPA on their website has an excellent list of the cleaning products that you can buy in every store that'll work against this virus. So using those, making sure you're following the label for contact time. So once you spray down and wet a surface, to pretty much let it air dry, let that product do its work, and that should take care of that virus on those surfaces.
And how frequently should those surfaces be cleaned? I mean, before leaving for home today, if I wipe down my keyboard, wipe down my desk, do I have to do it again tomorrow morning?
You know, I would say in a case like this, when there's still a lot that we're learning, right? Any of those high use areas like your mouse, your keyboard, the doorknobs, any of those areas, you probably want to clean on a more frequent basis than you normally would. So if you get a lot of people that may be using that same item, it's probably good to clean that on a frequent basis throughout the day. So any of those high use, high traffic areas should be cleaned down frequently. You
know, we often joke about NPDA when you see somebody that you know, but that actually is a pretty good idea right now, as to not embrace, not kiss, not shake hands, but how do you greet someone these days?
So we're doing the elbow bumps now.
Yeah, so
it's the new
elbows,
thing. And you can also do the foot tap.
Little foot taps, very helpful, because it's true, right? We think about our hands. Our hands contact everything. They're high contact surface. We use it to touch everything. It's really good at having germs on it. At times the palms can be a little wet, moist, and that helps to trap all of these microbes in there. So making sure we're washing hands, keeping those clean, you'll hear that message. The most important public health methods, wash your hands.
And I was also at an event this weekend in New York, and instead of hugging, some people were just doing this towards the other person. So it's changing our lifestyle, I guess. But the alternative is not good either. What about my car? Should I wipe down my steering wheel and my shift lever?
Well, it's always a good thing to do that, right? I mean, if it's just you that's using that vehicle, you probably only have to worry about yourself. But if you have guests in your car, other people which could drive it, it's really good just to get in the habit of cleaning down everything that we touch on a high-use basis.
So if I've coughed or sneezed into my arm, to the cleaners when I get home?
You can just throw it in the wash, and also on a high heat cycle should kill everything. So you should be fine.
Nashua has a very high senior population. Some are pretty good with computers, others are not. Have you put a plan in place on how to get the message out and communicate with them?
Yeah, so we work with our long-term care facilities actually often anyways, so it's been really nice. We've been able to get in contact with them easily. We're putting the same messaging out to them as well, sending them any information that we have.
Yeah, and I would also add that the older folks, 60 plus, are those that have an impact greater than the rest of the people with this virus. So a lot of our focus is to hit those long-term care, elderly housing, those groups, as well as following the CDC guidance for that older group, is that if they don't have to go out, to limit their exposure outside because they are in that high-risk group.
Talked to Dr. Mosley, and he suggested if people have questions or concerns or want to know the latest in the schools, to go to their webpage, to watch their Twitter account if they have the school department on Twitter. How should people with questions contact public health?
Yeah, so we're very active online. We want our community to be prepared, not scared. So you can visit us on our website. We're www.nashuanh.gov/DPHCS. We have links to the CDC as well as the New Hampshire Department of Health and Human Services, a bunch of information. And you can also follow us on Facebook, we're on Twitter, we're on Instagram as well.
And those are updated as needed?
Yes.
Pretty much?
Mm-hmm. I've been posting a lot of stuff on our Instagram, fun pictures, a lot of great information.
Anything we haven't covered in this program today that, or something that needs repeating, like wash your hands for at least 20 seconds?
Yes, I think you'll hear anybody in our field say, wash your hands. And I think, too, one other thing that needs to be stressed, it's been said, stay home when you're sick. Mm-hmm. If you do not have to go in, if you're sick in any way, and this is not just for this virus, but it's for flu, it's for any of those other issues which can really spread easily, is just to stay home.
Well, it's kind of like a good news, bad news story. The good news is those of us involved in city government know what a great staff that Bobby has over at the health department, and I think all of you have shown that here today. But the bad news is all of you have shown that here today and are now stepping up to combat this virus. And we want to thank you for taking time out of a busy day to be with us here.
Thank you.
Thank you.
You've been watching eYe Education, and we've been very fortunate to have the Director of Public Health in Nashua, Bobby Bagley, Angela Constantino, the epidemiologist for the city, Ren Bodwin, the Deputy Health Officer for the City of Nashua, Nicole Vio, the Health Promotion Communications Specialist, and Flavia Martin, the Public Health Nurse for the city, along with Dr. Jamal Mosley, the Superintendent of Schools. We hope that you have found this program informative and would urge you to continue to go to the public health site, the City of Nashua webpage, and follow any instructions that might be disseminated with respect to any changes and procedures with respect to the virus. Thank you for watching eYe Education. I'm your host, Ed Leishus. We'll see you next time.